Well, hello and welcome to my video seminar on the ethical violations by the psychologists in the family courts. I'm going to be beginning with sort of a foundational ethical violation, standard 2.01, boundaries of competence. All ethical standards for all professionals have a boundaries of competence standard. 2.01 is for the psychologists. And what 2.01 says is that psychologists provide services, teach, and conduct research with populations and in areas only within the boundaries of their competence based on their education, training, supervised experience, consultation, study, or professional experience. And I want to point out that basic three are competence based on your education, your training, and your experience. Notice it says supervised experience as well. And so the forensic psychologists in the family courts are not competent in the following necessary knowledge based on their education, training, and experience, their vitae. They're not competent in attachment pathology in childhood. They're not competent in delusional thought disorders. They're not competent in factitious disorders imposed on children. They're not competent in family systems pathology. They're not competent in complex trauma and child abuse. They're not competent in personality disorders. There's a variety of things, but these are the main ones. And in particular, the attachment pathology and delusional thought disorders. So let me say something about that, because a child rejecting a parent, a child seeking to flee a parent, that's an attachment pathology. That's a problem in the love and bonding system of the brain. So if you're going to assess, diagnose, and treat attachment pathology, you need to be competent in the assessment, diagnosis, and treatment of attachment pathology. In addition, the pathology we're concerned about in the family courts is a false, factitious attachment pathology imposed on the child for secondary gain involving a delusional thought disorder in the parent, a persecutory delusion that's then being induced and created in the child, an induced or shared persecutory delusion. So if you're going to assess, diagnose, and treat a persecutory delusion, you need to be competent in the assessment, diagnosis, and treatment of delusional thought disorders. So those are the two big ones, and then we can just go down the others: family systems, personality disorder, child abuse, complex trauma, things like that. So let's first sort of ground ourselves in what competence looks like on a vitae, and I'm going to use my vitae as an example. So on my vitae, if you look at it, you will see the competence demonstrated on the vitae in my background, education, training, and experience. Starting with, my initial training was in early childhood mental health, 0 to 5. That's the attachment system, 0 to 5, at Children's Hospital of Los Angeles. Then I'm also have a certification in infant parent mental health. Again, that's attachment, from the Field and Graduate Institute. I was trained in 2 additional attachment therapies: Watch, Wait, and Wonder and Circle of Security. And I have clinical experience as clinical director for a treatment center for children ages 0 to 5 in foster care. Foster care is attachment, 0 to 5 is attachment. So to take a look a little bit closer at that, so in those boxes, what the vitae says. So you see my postdoc and predoctoral training there. So I received training in early childhood mental health, attachment pathology from Dr. Marie Polson's early childhood program at Children's Hospital of Los Angeles. So the predoctoral program, I was involved in consulting with the preschools, and then the postdoctoral fellow, I continued to work with that early childhood mental health program. Now, in addition, as I said, I have infant mental health. So I'm certified in parent-infant mental health, which is attachment pathology through the Fielding Graduate Institute. And there's the entry on my vita. In addition, I know 2 additional diagnostic systems for early childhood. The DMIC, which is stronger in diagnosing autism spectrum pathology, and the DC 0 to 3, which is stronger in diagnosing attachment pathology. In addition, I have been trained in 2 early childhood attachment therapies: Watch, Wait, and Wonder for infants and Circle of Security for preschoolers. And there's the entries on my vita. In addition, I have clinical experience with attachment pathology. I served as a clinical director, upper staff, for a 3-university assessment and treatment center for children ages 0 to 5 in foster care. 0 to 5 is attachment pathology. Foster care is attachment pathology. And Child Protective Services was our primary referral source. I have experience with child abuse and complex trauma. There's the entry on my vita. So, regarding delusional thought disorders, what would that look like on a vita? Competence and delusional thought disorders. Well, I have 12 years of annual training in the diagnostic assessment of delusional thought disorders at a major UCLA NIMH National Institute of Mental Health study on schizophrenia. There's the entry, where I was trained to diagnostic reliability to the head of the VA diagnostic unit, Joseph Ventura and David Lukoff, who are also co-authors with BPRS, one of the oldest, most widely used scales to measure psychotic symptoms. Now, the forensic psychology, the examples, I'm going to go through some examples of the vita from some of the top forensic psychologists. So these are the top tier. So recognize everybody under this top tier of forensic psychologists is less competent, is worse. This is the best in forensic psychology. So let's take a look at their vitas. Now, in evaluating a vita, we're going to look at 3 things: education, training, and experience. So what we want to see is a BA in psychology to a PhD in psychology, clinical psychology. Sometimes we'll get a master's in there, and then we'll look at whether it's a university or professional school. Now, what should happen for most people is you go undergraduate for psychology, because you're going to be competing with a lot of people for these top psychology programs, or even for the middle psychology programs. And so these psychology graduate schools will be selecting from psychology majors. So you do a psychology major as an undergraduate, then you have to get really good grades, then you apply to a PhD program. So we'll see, bachelor's in psychology to a doctorate in psychology. Sometimes we'll get a master's degree in psychology within there. I did that. I took a time off and went to the master's before going to doctorate. So sometimes, but that should also be in psychology. And then what we want to look at is the quality of the university. And so top tier universities versus, it keeps going down the list until you get to basically professional schools that they don't require necessarily that you were a psychology major, you have any psychology training. So the professional schools deal with people who want career changes. They've been in a different career, they want to get into psychology, and the doctoral school will assist them in getting their doctorate work. The training, we're interested. The first training is your APA internship. Is it APA accredited or not? Then where'd you get your postdoc training? And then we look for any additional training in their specialty domain. Like I have the training in the attachment therapies and the training in the diagnostic systems and that. So we'll look for training on their vita. And then work experience. Relevant work experience in the pathology, such as clinical director for children in foster care, or work at Children's Hospital having to do with factitious disorders, those sorts of things. So we'll look at the relevant work experience, as well as the breadth of their work experience in both the type of activities they've been doing, as well as the different pathologies they've been working with. I always say the education prepares us to learn, but it's the pathology that teaches us. So it's actually working with the pathology, ADHD, autism, trauma, whatever it is that you will learn about the pathology. So that experience is really important. So what is not relevant to competence are opinions. These are the presentations, and opinion articles are not relevant to competence. Data-driven research articles are somewhat related to competence or relevant to competence. Primarily, they show the areas of the professional interest. And then for teaching positions, again, are marginally relevant, and only if the course is relevant. Because to teach a course requires that you know the curriculum for that topic area. So it tells us that you know something about that, or you know that topic area if you've taught assessment or if you taught diagnosis course, at the graduate level or something like that. But otherwise, it's not showing that you have acquired the information. It's telling other people your opinions about things. So we'll begin with Dr. Leslie Drozd. She's on the editorial board of the AFCC journal Family Court Review. She's been in the family courts her entire career, a long time. She's one of the considered one of the top forensic psychologists in the family courts. When I entered the AFCC this past year, I took a 4-day, 8-module advanced course in parent-child contact problems from a set of 6 of their top forensic psychologists, and Dr. Drozd was one of the presenters there. And then just recently, I attended the conference for the Washington chapter of the AFCC here in Seattle, and they had 2 speakers, and one of the invited speakers for that conference was Dr. Drozd, and so she came up and presented again. So she's promoted by the AFCC as being a top expert in the family courts regarding the pathology that's here. So we're going to take a look at her vitae and see what that looks like. So starting with her education, she has a PhD in clinical psychology from California School of Professional Psychology in San Diego. So there's your professional school on that. And it was 1986, quite a period, a long time ago. She began, if you look down at the bottom there, with a bachelor's degree in political science and history and from UC Santa Barbara. And then she got her teaching credential from UCLA. And so what we're looking at here is she, and got her bachelor's degree in 1970. Now, I graduated high school in 1972, so she graduated college before I graduated high school. So she's getting up there in the more advanced years of her career. And so will likely be winding up her career in forensic practice. But then it looks like she then got her teaching credential and started to teach in, LA or whatever, San Diego area for about 10, 15 years, and then decided to go back and do a career change. That's typical of a professional school situation. She goes back to get her doctorate degree. Now, what I want to point out about her education is the only psychology training she has ever had was limited to her doctoral program. She did not have a bachelor's degree where she got a foundational knowledge of psychology. So she's only got training or education in psychology, 40 years ago, and had no training or education since that point in issues of psychology. And then her work experience is she's been a therapist in private practice since 1988. That's it. That's a sum totality. If you can go and pull it off offline, the Vitas are available online, and you can look at it. And she's done a lot of opinion piece publications, a lot of presentations, a lot of stuff. But in terms of work experience, that's it. So she has minimal education, one doctoral program, that's her education in psychology. She has minimal work experience and no evident additional training on anything. So so that is essentially Dr. Droyd's vita. Now, if you were hiring for a job and this vita comes in, that's an awfully thin vita. I know entry-level psychologists are going to have potentially stronger vitas than that, and she's the top. This is one of the top forensic psychologists, and that is the sum total of her relevant vita for competence. I don't see where Dr. Droyd's is competent in the following areas based on her education, training, and experience, or vita. When I look at a vita, I don't see where she's competent in attachment pathology, the diagnostic assessment and treatment of attachment pathology. In delusional thought disorders, I don't see where she's acquired her education, training, and experience in the diagnostic assessment of delusional thought disorders. Complex trauma and child abuse, I don't see where she's acquired the competence or background, education, training, and experience in the diagnostic assessment and treatment of child abuse and complex trauma. Family systems, I don't see from her vita where she acquired her competence based on her education, training, and experience in the diagnostic and assessment and treatment of family systems pathology. So now let's take a look at another forensic vita here. This is of Dr. Matthew Sullivan. He was also one of the presenters at the 6 or 8 module 4-day advanced seminar, and he's a former president of the AFCC. So again, these are the top people. He was a former president of the AFCC. So let's take a look at his vita. His education, he has clinical community psychology. He has a PhD in clinical community psychology, 1985, from the University of Maryland, College Park, Maryland, and a bachelor's degree in human biology from Stanford. Now, when we look at that type of vita, it appears biology. So again, we have a bachelor's degree in something other than psychology. So his training in psychology is from his doctoral program. Now, the biology degree at Stanford's obviously a good school. Biology degree undergraduate, I think he was probably going pre-med and looking to be pre-med. And then when he graduated, he applied to medical schools. And you can look 78, it looks like maybe there was a year or two gap there before he went back for a doctorate in psychology. So he probably applied to med schools, didn't get in, and then went to University of Maryland, which is a little drop from Stanford. No knock on Maryland. But that's the type of thing that Maryland, as a graduate program, will do for a biology degree. You're not coming from psychology, competing with all the other people who have psychology bachelors, but you're coming out of Stanford, and it's a degree, it's a related degree, human biology. So they took him for that. Then his work experience is from 1990 to present. So pretty much he graduated 1985 and his doctorate in 1990 to present, probably postdoc and getting organized. He's been a licensed psychologist in private practice, providing general psychology services, children, couples, and families, specializing in child and family forensic psychology. So again, his only work experience is in private practice. So now let's take, for example, Dr. Childress. We'll look at my vita for the breadth of experience. So I was at UCLA and then NIMH research project on schizophrenia. I was also on a project for Williams syndrome and Prader-Willi, but that was only for a year, and so I don't put it on my vita. But I've got broader experience even. Did my pre-doctoral and postdoctoral training at Children's Hospital of Los Angeles. Then I was at Children's Hospital of Orange County as a pediatric psychologist on medical staff. Then I was at UCI Child Development Center as the lead clinical psychologist on an ADHD project for ADHD in preschoolers. Then I was clinical director for a Department of Justice FEMA project regarding assessing juvenile fire setting behavior. Then I was a clinical director for an assessment and treatment center for kids aged 0 to 5 through the Cal State University and county-wide project, and private practice in the family courts. So you can see there's a breadth of experience working with ADHD, oppositional defiant, trauma, autism spectrum, schizophrenia, just a broad spectrum of experience, as opposed to simply private practice. You're not interacting with anybody. And let me say something about private practice in the family courts. That's relatively easy because you're getting court-ordered patients. Okay, so first off, if the only thing you've done is private practice, as I review Vitas, if I'm senior staff and I'm looking at Vitas and all you've done is private practice, no one's ever hired you. Okay, you look at my Vita, a lot of people have hired me over the course of time, but private practice, no one's ever hired you. That's one thing. And then if you're private practice in the family courts, you're getting court-ordered patients. Okay, so private practice in clinical psychology, you're getting referrals. So you're being successful because other people are saying you're a good therapist. To be in the family courts, you're not getting referrals, you're getting court orders. People need this and you're conducting your assessment because that's the only thing you give them. That's not a very challenging position. So I'm not sure what that demonstrates. So again, with Dr. Sullivan, and he's former president of the AFCC, one of their top, I don't see where Dr. Sullivan is competent in the following areas based on his education, training, and experience. His vita: attachment pathology, the diagnostic assessment and treatment of attachment pathology; delusional thought disorders, diagnosing and treating delusional thought disorder; complex trauma and child abuse; or family systems pathology. So I'm not seeing it on his vita. I don't know. Are the forensic psychologists simply exempt? Because that's what I look at. When I look at Dr. Sullivan's vita for competence, that's his education. He got a doctorate degree in 1985. That's his only training in psychology, education psychology. And his work experience is in private practice, getting court-referred people and doing custody evaluations. So let's take a look at Dr. Michael Saini. Michael Saini is the current president of the AFCC. So the Michael Saini is the current leadership of the Association of Family and Conciliation Courts. So let's take a look at his vita. Dr. Saini's out of Canada. And so his doctoral degree is from the Factor into Wantash Faculty of Social Work. He's got a doctoral degree in social work. He has a master's degree from the same school in social work. He has a honors bachelor's in social work. And he has another bachelor's in sociology. He has another bachelor's in law and justice. So if you work from the bottom up to kind of follow what he did, he got 3 bachelor's degrees. The first one is law and justice. So obviously he's interested in some sort of legal aspect of things, not psychology. He then got into sociology, not psychology. And so he's getting no coursework in psychology, no grounding foundation. He's getting some law stuff. He's getting some sociology stuff, political science kind of domain. Then he goes for a bachelor's in social work, not psychology. Then he goes for a master's in social work, not psychology, and a doctorate. So I'm not seeing for Dr. Saini, where he's competent in clinical issues, clinical psychology, which is the diagnosis and treatment of pathology and things like autism or things like factitious disorders or delusional thought disorders or family systems or psychotherapy or where's his training in psychotherapy? He's been trained in social work, but not clinical psychology. So that, if I need social work services, absolutely, I'd turn to, Dr. Saini. I don't need social work services. I need a diagnostic assessment of delusional thought disorders. I need a clinical psychologist. So based on his education, I'm not sure where he's competent with the pathology here. So again, looking at my vita, for example, I have a bachelor's degree in psychology. That's 4 years of taking undergraduate courses in developmental, physiological, learning, therapy, diagnosis, all of the psychology courses for 4 years of undergraduate training. Then I got another master's degree in clinical community psychology, additional training in clinical psychology. Then in addition, I got my doctoral degree out of Pepperdine in clinical psychology. So I know how to diagnose and treat pathology and how to assess for it as a clinical psychologist. I'm not sure Dr. Saini does. That's his work experience again. So when we look at that, 2003 to present, basically his entire career, he's been in private practice. Parenting coaches, custody evaluation, consultation, expert testimony. And if you look at his vita, he's got a bunch of academic appointments, a few academic appointments, let's put it that way, to the social work graduate school, teaching social work, teaching classes in law and potentially forensic custody evaluations in the law. So it's very limited. He's a social worker, and he teaches custody evaluations too in the School of Social Work. So when I look at Dr. Saini's vita, the current president of the AFCC, that's it. And I'm beginning to see a pattern with this, where these forensic psychologists got a degree, a doctoral degree. I have Drozd with, with the professional school, California School of Professional Psychology, no psychology training other than that. Then she goes into private practice in the family courts where she's getting court-ordered patients, and she does her custody evaluations. I have Dr. Sullivan. He gets his doctorate degree. He goes biology, and then he goes Stanford, and then tries pre-med, goes and gets a doctorate degree, and then goes into family courts and gets court-ordered patients to conduct his forensic custody evaluations. Dr. Saini gets social work degrees, then goes into private practice in the family courts, getting court-ordered patients to conduct the forensic custody evaluations. And so that's, in my view, as a clinical psychologist, a very thin vita. And so for Dr. Saini here, based on what I see on his vita, I don't see where Dr. Saini is competent in the following areas based on his education, training, and experience in clinical psychology, in the diagnosis and treatment of psychopathology. I'm not seeing where he's competent. Attachment pathology, the diagnosis and treatment of attachment pathology. Where on his vita does he show he got that training or education or experience? Delusional thought disorders. I don't see where he's competent in the diagnostic assessment of delusional thought disorders, especially as a social work doctoral degree rather than a clinical. I don't see where he's competent in the diagnostic assessment and treatment of child abuse and complex trauma, and that's our diagnosis in the family courts, differential diagnoses of child abuse and complex trauma going on. But where has he worked with that? Where has he gotten training in child abuse and complex trauma? I see where he's gotten in social work, but not in trauma and child abuse. And where does he get his training in family systems work? Social work is not a therapy degree. That's like hooking up to social services kind of stuff, or changing society kind of things to, help provide benefits to the folks who are less privileged or have less resources. That's not psychotherapy. and that's not diagnosing clinical pathology. So based on a review of the vitae, I'm not sure where he's competent in the necessary domains of knowledge. So, and that's the president of the AFCC. These are the top people within the AFCC. Dr. Robert Simon, editorial board of the Family Court Review. So Dr. Simon and Stahl, Dr. Stahl, have written 2 books on doing custody evaluations in the family courts. The first one was in 2013, Forensic Psychology Consultation in Child Custody Litigation, a Handbook for Work Product Review, Case Preparation and Expert Testimony, published by the American Bar Association 2020. They published a second book on that, or second edition on that. So Dr. Stahl and Simon here have literally written the book on how to conduct a forensic custody evaluation. Now, when we get further down the road into the experiment on human subjects of a quasi-judicial role for doctors and an experimental assessment procedure of forensic custody evaluation for this experiment on human subjects, they're kind of the ones, this is the protocol for it. This is the experiment. They describe the experiment on human subjects here. Now, my concern is we never did a risk-benefit analysis on it. There's been no oversight to it, and you shouldn't experiment on human subjects without getting oversight. But I'll talk about that in a separate video talking about the concerns relative to the Belmont report and experimenting on human subjects. But Dr. Simon and Dr. Stahl are, again, the top forensic psychologists in the family courts. So let's take a look at Dr. Simon's vita. So he graduated the doctoral degree from California School of Professional Psychology, San Diego. Seems to be a popular program. He has 2 years at University of Minnesota Institute of Child Development, got a master's there, and then a bachelor's degree in psychology. So with Dr. Simon, you can, first off, you see that California School of Professional Psychology again coming in. So we're not talking like major universities, doctoral programs. We're talking kind of the lower level of doctoral programs. The other feature, but he has 2 years at the Institute of Child Development. Now, what I'm going to do with that, 2 years at the Institute of Child Development, University of Minnesota, got a degree in child development, master's degree in child development. I'm going to give him attachment. Now, you saw all the stuff in attachment pathology on me, but I'm not going to argue with him about attachment. Hopefully, Minnesota in their 2 years taught him about attachment pathology, but it's going to be really slight. 2 years at a master's program. But I'm not going to argue with him about the attachment pathology there. And it looks like what happened here, you see the San Diego, it looks like, he graduated and then something happened where he moved back to Minnesota and he got a master's degree in Minnesota. But he didn't go directly from his BA in psychology into a doctoral program in psychology. He took a little side step and then comes back to California School of Professional Psychology. Now, his work experience, again, independent private practice from 1987 on in forensic psychology, forensic custody, consulting, child custody evaluations, forensic case consultation, expert witness. So he's very narrow. He went into the family courts, wrote his books on how to do this experimental forensic custody evaluation approach. He has additional work experiences here, but look at his work. He is the trial faculty for the Trial Advocacy Institute, so that's not relevant to attachment pathology or delusions or, any of the pathology, child abuse or complex trauma, any of the things we're worried about for competence. Child custody mediator for, he did that for a while. The faculty was only for a year, so brief thing where he taught at the Trial Advocacy Institute. For a law school or something. And then he had a couple of years way back as a dispute resolution services. He was a volunteer position. So this Well, again, just emphasize, this is the vita of the top forensic psychologists. Everybody other than this has a vita that's less substantial than this, which I'm finding pretty insubstantial. I'm just not seeing any clinical experience with delusions of attachment pathology, child abuse or complex trauma, even oppositional defiant disorder, ADHD. I'm not seeing any breadth to that experience, both relevance and breadth. So for Dr. Robert Simon, who's on the editorial board of the Family Court Review, I do not see where Dr. Simon is competent in the following areas based on his education, training, and experience, his vita. Delusional thought disorders, the diagnostic assessment of delusional thought disorders. Now, I'm going to say that that's the major one I'm going to knock with Dr. Simon, this is a potential delusional thought disorder. So where in his background, education, training, and experience does he have competence in the diagnostic assessment of delusional thought disorders? Okay, based on his education, training, I'm not seeing it. Personality disorder pathology. He has a master's degree in child development. So we'll take and we'll give him credit for attachment generously, but personality disorders in adults, I don't see that where he has that experience. Narcissistic, borderline, dark personality. Factitious disorders, factitious disorder imposed on another. Where's his training in factitious disorders? Where's his experience in that? Complex trauma and child abuse. Where's his experience working with child abuse? Where's his experience working or training, working with family systems? I'm not seeing any relevant domains of competence. Take his co-author, Phillip Stahl, also on the editorial board of the AFCC Journal Family Court Review. Now, let me point something out here. We have the presidents of the AFCC. We have the editorial board of the AFCC's journal that they can feed their opinion pieces into and out. And do you begin to get a sense that there might be a conflict of interest? Do you begin to get a sense that there's a small group of forensic psychologists who are promoting themselves and their own ideas for their personal gain, and that they really haven't expended the effort to become competent in the necessary domains of knowledge, like attachment when you're working with attachment pathology, John Bowlby, Mary Ainsworth, others, like personality disorders when you're working with narcissistic, borderline, dark personalities, like family systems when you're dealing with family systems. That'd be, family conflict. That'd be Mnuchin or Bowen or Madonna's, or complex trauma, child abuse. That'd be Bessel van der Kolk. Any domain of knowledge? No. But they're very specialized in conducting forensic custody evaluations, which are this experimental approach where they don't diagnose and don't treat, and they've developed an experimental assessment protocol for that. That's not part of healthcare. Right. So here we have Dr. Stahl's vita, his education. So he has a doctorate degree in education. So his doctorate is not in psychology. And then he puts, it's in guidance counseling. So he has, again, one of the lowest level doctoral you can get and be in clinical psychology. You got a doctorate in education guidance counseling. Now, guidance counseling is for adults in school. That's your college students. That's not attachment pathology. That's not family conflict. He has a master's degree in clinical psychology out of Eastern Michigan, and he's got a bachelor's out of University of Michigan. So a Michigan boy there. So he has psychology and doctoral in education, raises an eyebrow, but he's in the family courts. Now, his work experience, 1983 to present, private practice. There's a pattern. They just get their doctorate degree in education, in social work from a professional school. You used to be a teacher. Now you want to become a psychologist, professional degree. They get their doctorate degree. Then they go into private practice in the family courts, conducting these lucrative $20,000 to $40,000 custody evaluations for the court, in which they do not diagnose and treat pathology. They just offer the courts their opinions on what the custody schedule should be. That's an experimental role for doctors. Then, so private practice. He's also has the director of forensic programs for Steve Frankel Group. So apparently Steve Frankel has a group of psychologists, and Dr. Stahl is part of that as the forensic psychologist, and they may have somebody directing the ADHD program or substance abuse program or something. So somebody hired him. That's good, to direct the forensic psychology program. Then way back, he was on a panel of juvenile court evaluators like 20 years ago. And then he was a psychologist evaluator when he started out. Yeah, Dr. Stahl lists things multiple times, and so it's a little bit of a confusing vita. So I'm not sure what that psychologist evaluator, what difference that is from the private practice forensic custody evaluations, but we'll put it on as an additional experience. However, it's all very limited. It's all in one domain. So as I review the vita of Dr. Stahl, I do not see where Dr. Stahl is competent in the following areas based on his education, training, and experiences. Vita. Attachment pathology, the diagnostic assessment and treatment of attachment pathology when you're diagnosing, assessing, and treating attachment pathology. Child rejecting a parent. Delusional thought disorders. That's a differential diagnosis. I don't see where he's competent in diagnostic assessment of a delusional thought disorder. Complex trauma and child abuse. I don't see it on his vita. Do you see it? I don't see it. Look at his vita. You can go grab it off the internet and see where he's developed. He has education, training, and experience in complex trauma and child abuse. Or family systems. The diagnostic assessment and treatment of family systems, personality disorders, just the whole range of factitious disorders imposed on the child as well. So the APA Ethics Code, again, says psychologists provide services, and this is mandatory, required. Psychologists provide services, teach, and conduct research with populations and in areas only within the boundaries of their competence based on their education, training, supervised experience, consultation, study, or professional experience. And I just don't see that any of them are competent in the necessary domains of knowledge, which would be a violation to Standard 2.01 of the APA Ethics Code. They don't know the necessary knowledge. And that's going to lead to their other violation, 2.04, where they don't apply the knowledge because they don't know it. Now, if you Google the word ignorance, the definition is lack of knowledge or information. And I would assert that based on the Vitas, that Dr. Drozd and Sullivan and Saini and Stahl and Simon are ignorant by definition of the English language. They lack knowledge and information about attachment, personality disorders, child abuse and complex trauma, delusional thought disorders, family systems. If I have to educate, let me pull this up for a second. If I have to educate the doctor about what the pathology is and its diagnosis and treatment, that doctor is not competent with the pathology by a demonstrated need to be educated about it. The doctor should already know. I should not have to educate the doctor to have a professional level discussion with them about their patient. That's their responsibility to educate themselves to be competent so that I don't have to educate them. Okay? If I have to educate them, they are not competent by demonstrated need to be educated. And the patient should never have to educate the doctor about the pathology. Now, do you think the patients of Dr. Sullivan or Saini or Drozd need to educate the them about the nature of persecutory delusions and how to assess for it, or factitious disorder imposed on another, or attachment pathology. It's a motivational system. All motivational systems have direction. So the only cause for a change in the motivational direction is child abuse. You have to educate them about that. Okay, the attachment system is a goal-corrected motivation system. It always maintains the goal of bonding to a parent. Do we have to educate them about that? If we do, they're not competent in that, and they are ignorant, by definition of the English language. If you Google the word indolence, that's avoidance of activity or exertion, laziness. Okay, so as far as I can tell, they've been in the family courts for 40 years, mid-80s, and none of them have expended the effort, exerted themselves to learn family systems, to learn delusional thought disorders, to learn attachment pathology, to learn about child abuse and complex trauma. They just do their custody evaluations at $20,000 to $40,000, 6 to 9 months, and don't diagnose what the pathology is. My opinion, the family courts are no place for professional ignorance, and the family courts are no place for professional indolence. This is child abuse, and it is too important to the child and to the court to have ignorant and indolent professionals working in the family courts. So with that, I'm going to wrap up my video or my seminar here on the violation to standard 2.01, boundaries of competence in the family courts. Now again, figure these are the top, the vitas I reviewed here are of the top tier, relatively, of forensic psychologists. So you figure everybody below that, who's not in the top tier, has less competence than these and that's another feature about leadership. Okay, we have editorial members of the editorial board, we have former presidents of the AFC. In leadership, we should lead by example. The leadership should have the best vitas and the best support. They should be going out and showing others what it takes. They should be getting the training in attachment and leading others into the training in attachment and personality disorders and things. If the leadership is indolent and ignorant, then that's a role model for everybody else to be ignorant and indolent. And that's why they have to make up new forms of pathology, like parental alienation, made-up pathology label, like resist-refuse dynamic, a made-up pathology label, like parent-child contact problems, a made-up pathology label. That is evidence that they are ignorant, lack knowledge or information about real things like attachment, family systems, delusional thought disorders. If they're not, they should apply that professional level knowledge and reassure us that they know it. But I don't think they know it. Okay, I just, based on their vita, based on their violation to 2.04 that we'll talk about next, I don't think they know what they need to know to be competent in the family courts. That's a problem when your top president of the AFCC he's not an expert. That's what I'm worried about. He's not an expert. He's not even competent. Wow. In any other field, an expert, Jim Swanson. What is Jim Swanson? He knows ADHD. You better believe it. Keaton Ackerline knows, schizophrenia. The top experts absolutely know the pathology. Over here, we have top experts who aren't even competent, and they've been in the family courts for 40 years, and they're in positions of authority where they run the AFCC as a president. They're providing information to the attorneys of the AFCC that support their ideas and not exposing the attorneys to other information like about DSM-5 diagnoses, delusional thought disorders, withholding that information. And they're offering trainings to others. I attended one where they're not providing actual knowledge. They're just promoting themselves and saying it's parent-child contact problems, their new pathology. There is no pathology unique to the family courts that doesn't exist everywhere else in society. So this idea that the family courts have a unique new form of pathology is thought disorder. There's no pathology that unique to the family courts. If it's in the family courts, it exists everywhere, and it's only being triggered by the family courts. So with that, I'm going to move off to my next in the series on the violation to 2.04, bases for scientific and professional judgments. If they don't know the necessary knowledge, attachment, delusional thought disorders, factitious disorders, child abuse and complex trauma, personality disorders, family systems, if they don't know the necessary knowledge, then they don't apply the necessary knowledge as a basis for their professional judgments. That's a violation of 2.04. All the 2 series in the APA Ethics Code are competence standards. So with that, take care, everybody.